listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, change happens, whether it's the Medicare industry as a whole, your clients' needs, or the plans that are offered. And those are only some of the factors to consider. We are here to help you prepare with 7 reasons clients switch Medicare plans during AEP, written by Isabel Vitale. When AEP, the annual enrollment period, comes around each year, you should encourage your clients to review their Medicare coverage and, in some cases, help them switch to a different plan. According to a study done by KFF in 2024, a whopping 69% of Medicare beneficiaries did not compare their current plan to different options during the 2022 AEP. It's possible your clients are due for a change. By looking at their coverage before each AEP, your clients can potentially save money and review if their current plan is still working for their lifestyle and budget. Here are some of the reasons your client might need to switch to a new plan. Reason number 1, their plan costs too much. Many factors contribute to the cost of a plan: premium, deductible, co-payments, and coinsurance. These costs can change from year to year, creep up, and become too high for some beneficiaries. For example, perhaps your client on a Medicare supplement can't handle the monthly premium anymore and is wondering about a Medicare Advantage plan. AEP is the time to see if your client's plan is still affordable for them, or whether another option might be a better fit. Chances are you may be able to find a plan that will lower your client's expenses. Reason number 2, their health needs changed. With age comes varying changes to the coverage your client needs. A relatively healthy 65-year-old enrollee likely has different needs than an 85-year-old one. Has your client received a new diagnosis? Health status changes necessitate a review of coverage to ensure your client finds the right fit for their unique circumstances. If they were recently diagnosed with a chronic illness, perhaps a chronic special needs plan or C-SNP is more suitable. What about a new drug not covered on their current plan's formulary? Time to look for prescription coverage that covers all their medications, like a new MAPD or Part D plan. Reason number 3, their financial status changed. If your client hits financial hardship, it may mean they can qualify for extra help, the Part D low-income subsidy, or a dual-eligible special needs plan, D-SNP for short. Likewise, if their financial situation has improved, they may lose eligibility and need to enroll in a different plan. When you review a client's coverage, remember to tactfully inquire about their financial resources and always check to see if they qualify for extra help. Reason number 4, they're not satisfied with the carrier's service. Your client might be dissatisfied with their plan for any number of reasons. Did they have a claim denied? Did they receive a negative annual notice of change, or ANOC? Did the carrier not pick up the phone? If they've had a bad experience with their carrier, your client may be wondering how to change Medicare plans. It's important to let them air their grievances, then listen and empathize. The plan might offer the most stunning benefits, but without quality customer service to back it up, perhaps it's time to talk other options. Reason number 5, their plan's star rating changed. The Centers for Medicare and Medicaid Services, or CMS as we call them, have a Medicare star rating system in place to help beneficiaries discern where their current plan falls on the scale out of 5 stars. This annual checkup may reveal that they're not receiving the highest quality coverage available. Because CMS recently reconfigured the way they award star ratings, it's in your client's best interest to review their current plan to see if there's a better quality option in their area. Reason number 6, their doctor is no longer in network. A healthcare provider becoming out of network can happen because of your client moving or because of carrier or health system changes. If seeing the same primary care provider or specialist is important to your client, it might be time to switch plans. Reason number 7, their plan no longer exists. The Medicare market changes every year. When your clients receive their ANOC, they might be surprised to learn that their plan no longer exists and they're being transitioned to a new one. There are different reasons as to why a client would be moved to a new plan, including carrier downsizing, restructuring, and legislative measures. Make yourself available to your clients to discuss their ANOCs and schedule AEP appointments to review current coverage and whether it's time to switch plans. AEP is more than a time to enroll your clients in new plans. It's time to check in on your clients' changing needs and consider whether their plan is the right option to manage their health for the next 12 months. If their health needs or financial situation has changed, it could be time for a switch to a better fit. And remember, Ritter Insurance Marketing is here to help our agents through change. Reach out to our dedicated staff with your questions and receive personalized support. You can learn more about the benefits of registering with Ritter by visiting the link in the episode notes or by emailing us at asgpodcast@ritterim.com. Thanks for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Isabel Vitale, script adaptation by Tina Lamoureux, recording and production by me, Sarah Ruppel, podcast design by Urban Rivera. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.